Lively talk about Long Island life, national news, and international issues. It's Hofstra's Morning Wake-Up Call.
Nobody said this stuff makes any sense. We're hooked again. Point of no return. See how the buildings burn, light up at night. Such a pretty sight.
7:35 in the morning here on 88.7 WRHU. Rick Rossetto, Christian Perez, Kimberly Singh, now joined on the phone by one of Manhattan's leading plastic surgeons, Dr. Adam Schaffner, to discuss this bill in the New York State Senate that, when you think about it, really scary stuff. Dr. Schaffner, good morning.
Good morning.
So let's go over the major tenets of this bill. In the short form, the bill says that dentists practicing oral and maxillofacial surgery could do plastic surgery. Is that correct?
That is correct.
So what exactly are the other parts of this bill? That's the short form. What is the long form of this bill?
The long form of the bill, which is actually available online for any of your listeners who want to view it, basically states that it will allow oral and maxillofacial surgeons who have been granted privileges to perform certain procedures by a hospital to go ahead and perform procedures in the region of the oral cavity. And the question, of course, is what exactly does that mean? And there is actually, in my opinion, good purpose for this bill because oral and maxillofacial surgeons do perform a lot of trauma surgery to help patients who have sustained facial bone fractures, and therefore there's a need for modifications. However, the modifications need to be tailored to not have people sort of go off the reservation, if you will, and start performing facelifts or nose jobs, rhinoplasties, neck lifts, and the like. And so the real crux of it is, how does one define that region?
We've seen plastic surgery, Dr. Schaffner, as a whole. It's been in the news a lot lately. You've been hearing about, these fake doctors, even the ones who don't have any kind of certification, giving all these different facelifts, nose jobs, enhancements here and there. So, if we can go from that to someone who has qualifications as a doctor, but plastic surgery is a whole other ball game. When you look at that and it's saying, facelifts, nose jobs, rhinoplasties, for you as a whole, as a plastic surgeon, what goes into that and how difficult is that process?
Well, it's a challenging process, to say the least. For someone to become a plastic surgeon after graduating from medical school, they'll complete an internship and then a residency, which can be in one of a variety of prerequisite fields such as general surgery or ear, nose, throat surgery. It can even be oral and maxillofacial surgery if they have both an MD and then a dental degree. The training then continues on for specialization in plastic and reconstructive surgery, and then it can go on for additional training as what's called fellowships, where you can subspecialize from there. And the whole process takes a minimum of 6 years after medical school. Most plastic surgeons have anywhere from 7 to 10 years of training after medical school. So it's a long process where you study under many different individuals to hone your techniques and acquire the knowledge, training, and skill to help patients. And to your point, there are a lot of practitioners who are out there, most of whom are physicians, some of whom are not, who are trying to practice some form of aesthetic or cosmetic surgery, and they're calling themselves aesthetic doctors, cosmetic doctors, aesthetic or cosmetic surgeons. And so it's important for your listeners to know the difference between a cosmetic and aesthetic doctor and a plastic surgeon, and that is specifically that anyone with an MD or DO degree, anyone who's a medical doctor, can call themselves an aesthetic or cosmetic doctor or surgeon, as long as they have a valid medical license. Plastic surgeons will call themselves plastic surgeons. Now, that doesn't mean that plastic surgeons don't perform cosmetic or aesthetic surgery. They perform it all the time. But because of their advanced knowledge, training, and skill, they are very adept to handling not only the basic cases, but complex cases, revision cases, people who have unique anatomy. And that's very important for the safety of the patient.
Now, this is really interesting to hear that there's so many, there are different names and titles, but what should prospective clients be looking for in that case?
When they're looking to potentially have a plastic surgical procedure, they should ask their doctor, are you a plastic surgeon? Are you board certified? And not just are you board certified, but in what field are you board certified? Because a doctor can say, yes, I'm board certified, but they may be certified in internal medicine or pediatrics. And they may be a phenomenal internist or a phenomenal pediatrician, but they may not be great at performing plastic surgical procedures because they're not a plastic surgeon. So that's a real question that you have to ask in follow-up to the answer of, are you board certified, if the answer is just, yes, I am. It's also important to know whether or not your doctor performs procedures in an accredited facility. Accredited means that the facility has been inspected and has a sort of seal of approval, if you will, from a recognized body of within healthcare that makes sure that institutions and facilities are prepared to handle any issues that arise when a patient is having a procedure. And then lastly, it's also very important to make sure that your doctor has privileges at a hospital for the procedure that you're interested in, so that in the event that you need to be hospitalized either for the procedure itself or after the procedure, that you know that your doctor will be there and be able to take care of you.
Now, Dr. Schaffner, we've talked about the bill from the safety side of this for the patients, but I want to ask you about this from the business side, because let's be honest here, if this bill does happen to go through, doesn't that mean that you and your practice will also may lose some clients to the dentists and those who are going to be now able to do these plastic surgeries?
Well, I think that at the moment, the real focus is on patient safety. But you're right, when it comes to a business perspective, that there are a large number of individuals who are interested in cosmetic and plastic surgical procedures, and if they are being performed by non-plastic surgeons, there may be fewer procedures, one would think, than would otherwise be available. But the fact of the matter is that if one looks at the statistics, and the recent statistics for 2011 were just released online by the American Society of Plastic Surgeons, the number of cosmetic and plastic surgical procedures that are being performed have been increasing on an annual basis since the economy has started to turn around. And because of that increased interest, I don't think that plastic surgeons are really overly concerned that they won't have enough business. Most plastic surgeons, if you try to call up a plastic surgeon's office and schedule an appointment, you'll find out that you may have to wait a week or two to see the plastic surgeon. If you try to schedule surgery, you probably have to wait a few weeks for that as well. So I'm not so sure that the real focus here is on whether or not the plastic surgeons are going to have enough volume, insofar as that we want to make sure that the plastic surgeons are able to go ahead and render proper care to patients. And I should take this opportunity to note that there are many doctors out there, including oral surgeons, who have gone on for additional training and perform beautiful work in a competent manner. My comments are really tailored to those individuals who don't perform plastic surgery and haven't been trained in it. Go take a weekend course, or say, I'm going to go take a week off and go watch somebody do it, watch a few videos, and then try starting to perform it myself in my own office.
So the bottom line, Dr. Schaffner, as we wrap up, is that the bill that's currently in the Senate, as you mentioned earlier, does give some good qualifications to these dentists and these oral surgeons because of the trauma surgery that you mentioned. But when it comes to the facelifts, the rhinoplasties, the nose jobs, you believe that that part of the bill should be struck down. Am I correct in this? Or?
Well, the bill doesn't necessarily differentiate, and I think that the language of the bill needs to be clarified for that reason. Just as you wouldn't want me as a plastic surgeon performing wisdom tooth extraction or removal on a patient, so too would I think that an oral maxillofacial surgeon shouldn't be performing facelifts and nose jobs unless they have the training and the credentials to do so.
And again, the bill is on open.nysenate.gov, and the bill number S3059-2011, which will provide for the certification of and qualifications for dentists practicing oral and maxillofacial surgery. Dr. Adam Schaffner, one of the leading plastic surgeons in Manhattan, thank you so much for joining us and telling us more about this bill and about what's going on.
Thank you very much. Appreciate the opportunity.